Hello everyone, I'm Brittany Hoback, and today I'm here at L Massage with Lonnie Winters, the owner and your massage therapist. How are you today, Lonnie?
I'm doing great.
Awesome. So how long have you been a massage therapist here with this business?
With this business, I've only been here since November of 2013, but I've actually been a licensed massage therapist for almost 10 years.
Oh wow, so you've worked with, have you been on your own this whole time, or have you worked with different, physicians?
I've only been on my own a couple years. I've worked in chiropractic offices. I've worked side by side with surgeons because I took a surgical tech program in 2009 just so I could understand back pain a little better.
Okay, great. So you've been at this location, this new location here at the Bellefonte Pavilion, right next to Firm Fitness. You've been at this location since, you said November?
Since November, yes.
Okay. And you were downtown, am I correct?
Yes, I was at a couple places downtown, but I found that the difficulty with my clients parking and some of the noises, as the street noise downtown, really was an issue.
Sure.
So I started looking around and I found this place, and it was occupied at the time, but I just waited that out and I finally got in here last year.
That's great. Which is nice being right next to a gym so that, get those hard workouts in. They're like, oh, you're really good for a massage.
That's the important part, because massage therapy is just part of rehabilitation.
Sure.
Now, it's great that I can send them to a personal trainer afterwards where they can do their stretching, do their strengthening exercises, really bounce out the issues that they have.
Sure, absolutely. So you talked about the different certification that you had with the surgeon, but what type of schooling do you go to become a massage therapist?
There's used to be several locations. Lately, they've all closed down. There's still one, I think, in Cross Lanes, West Virginia. I went to Collins Career Center in Chesapeake, Ohio. Okay. Which is a one-year program, 1,000 hours, which allows you to set for the Ohio board. So I'm licensed in Ohio as well as Kentucky. Okay, so massage therapy actually does have a board exam too. Oh, absolutely.
Oh wow, I did not know that. So you learn something new every day.
Yes, and actually 45 states so far.
Oh, great.
5 more.
So that they're kind of waiting on to sort of get on board with the certification.
Yes.
Yeah, and I think that that's nice. I think it keeps everybody honest and, really makes sure that you understand the core principles behind, what you're doing.
Absolutely. That's important because there are several contraindications for massage, like take deep vein thrombosis. You don't want to apply much pressure to the legs or the areas that may contain that, because that could release a blood clot and it could really do some very, very damaging.
Sure, absolutely. So I mean, it's really important, like I said, to know all these different health concerns that are are out there, because you are considered an alternative mode for therapy, or as an adjunct to sort of work with physicians and work with the surgeons to sort of restore that normal form and function. And I think massage and acupuncture and all those other alternative forms are underutilized for sure. Because I actually went to an osteopathic medical school and graduated from there, and I don't practice medicine, but as an osteopath, you spend about 1,600 more hours focusing on the body and the musculoskeletal system and just the interrelationship of form and function, and about how important that is. And everybody, I think, in today's society wants to take a pill and think they're fixed.
Yes.
And that's a very bad misconception, that you really need to employ these different things with the physical training and then also the massage and all these other modalities to sort of to get a broad scoop of everything and then get your body back into its normal working condition.
Right. Actually, the best medication, I think, naturally is water. Like, you hydrate your muscles, they will become looser, more pliable, easier to work, and it has several effects on the organs, everything.
Sure. And I know water is something that I definitely never get enough of. It's so hard. I mean, and I just don't really like the taste of water, but I've been trying to hydrate a lot better, because it is important, because we're made up of water, and you know, it's better for our skin, and of course our body, and then the healing process as well. So what are some of the major benefits for massage therapy?
Well, a lot of the benefits comes down to basically two basic ones, relaxation and circulation. The circulation, like say diabetes. You have diabetes, if you, with the circulation, it actually improves the cell insulin intake.
Okay.
It makes it a lot easier to...
Sure, so whenever you go in there and you're massaging the muscles and things like that, you're sort of loosening up all that, any scar tissue that they may have or whatever, and it sort of gets the blood flowing down into those places, and then of course then it takes the toxins back out, which is important.
Basically what massage does, it makes the body work better and makes the body work faster.
Sure.
So anything I do, like they say that you're not supposed to drink alcohol before a massage, because it'll have an effect a lot quicker if you do.
Sure.
Same with the hangover.
Yeah, same with a hangover. Not a good thing to do. So I guess let's talk just a little bit about your typical patient, or what is the most common complaint that your patients have?
Low back pain.
Low back pain.
Definitely.
Yeah, that's a big one. I think everybody across the board experiences back pain at some point in their life. And so how exactly would you treat that low back pain patient?
Well, I actually have a protocol I do. Like one client I have has lumbar stenosis. So he comes in, I have him face up, I move his ankles around to make his hip move back and forth to see if I can determine tonicity and where I need to work. I'll work on releasing his hip flexors, and then I'll turn him on the side and I'll work on his like IT band, his quads, his hams, just all of this. And then I'll get to his hips, work on the piriformis, the gluteus medius, all the lateral rotators of the hip, depending if his foot is out to the side. I know that the lateral rotators are tight and they need to be addressed. And then I'll actually get to the low back pain last.
Yeah, which is, like I said, it's a very interesting approach, is that you don't really think that you're just treating just back pain, that, oh, we're just going to focus on just massaging this low back area, that there's all of those different components, because lots of times when we have back pain, we tend to walk differently, or even maybe walking differently, or having a knee injury or an uneven leg or something like that is what is causing our back pain. And if you can release those muscles and lengthen them and all that stuff, that you can then eliminate the cause for the back pain. Right. Which is, like I said, a lot of people do not think that. I think we'll just go right to the back pain, we'll take our pill for it, and then we'll be good. But really, there's so much other things involved.
And that's what I try to do. I try to educate my clients as much as like massage them.
Sure.
Try to get them to recognize their patterns.
Sure, and yeah, especially, and even like with the neck pain thing like that, with the women with the heavy purses. That's a big, it's a big issue, because you pound 30 pounds in those things and lug them around, and then like, oh, my neck hurts.
And I'll notice when they walk in, their shoulders will be like, oh,
exactly.
It's like you carry a purse on your right. How'd you know that?
You're like, well, exactly. You're drooping on that side a little bit. So there's a couple of different techniques in massage, and then, so there's the Swedish massage, correct?
That's the most basic massage you would see on television. If you go to spas, if they offer full body massages, usually 90% of the time it's Swedish.
Okay, and then you also have the deep tissue massage.
That would be several Swedish massage techniques that you would apply a different approach. Mainly to the speed. The deeper you go, the slower you go. You spread out the muscle, you cross fiber the muscle. You're basically working in a couple different areas for the overall. Swedish is more just broad, the whole thing.
The overall massage. Yes. So, and then also one I think is probably very popular, or getting popular this time of year because of the football and cross country and things like that are going on right now, is the sports massage.
Oh yeah.
Yeah, I'm sure that's with the knee injuries and of course the back pain and everything else.
I mean, it's injury prevention, it's performance enhancement. There's several different types of sports massage. Like there's pre-event, that's a shorter session that I would just work on the target muscles they're going to be using for that event. Anywhere from 48 hours to 15 minutes before the event.
Okay, wow. Yeah.
And the post-event massage is when they're cooling down, when I'm actually assessing what they've worked on and trying to figure out when they're working again to determine how deep I can go on them. Because I don't want to go deep and then mess up their game.
Absolutely. Now, I saw on your Facebook page where I was following you is that you have a couple events where you've done at the golf courses. Because, you know, improving this flexibility and range of motion is a big deal for a golfer.
Oh, yeah.
You know, so massage therapy can definitely help with that.
Sure. I'm certified in golf flexibility therapy, which I just do a simple assessment to see what muscles are indicated in the golf swing. And I write that down and I just work on those muscles, and I do that over a period of 5 weeks.
Okay.
And it's mainly the low back because of the hip rotation. But that's pretty popular.
Oh, I'd say it is.
And,
everyone's very intense about their golf swing and their golf game. I don't play, but I mean I know that it's a pretty serious sport to the boys that are out there doing it and keeping that score under a certain number. So let's just talk briefly about where people can find you. So you are located here at the Bellefonte Pavilion, and it's right down from Firm Fitness. And then what is your phone number if we're going to call and make an appointment?
You can call me or you can text me at 606-694-1014.
Okay.
And I work by appointment, so you can text me any day of the week. I work Monday through Saturday, anywhere from 9 a.m. until I take my last appointment at 7 p.m.
Oh, so you got an all day.
Yeah.
So.
And I live close, so.
So exactly. So if someone then were to text you and say, "I'd like an appointment at 4:30 or at 5," then you just, all right, pencil you in, and you come right over, which is nice. That you don't have to be here the whole entire day, just here for the the appointments, which is nice.
Right.
So you offer a couple of different options. I saw on your Facebook page is that you do have gift certificates available.
Yes.
So I know, especially with my husband, he is not someone who's going to come down here and make an appointment just because that's just not his style. But I'm going to make him an appointment before I leave here today because his neck has really been bothering him, and I think that he would benefit from that. But the gift certificates are nice for Christmas presents and birthday presents and things like that. So
and there may be a Christmas special coming up, but the only way you'll know about it is on my Facebook page.
Exactly, and that is El Massage, correct, on Facebook. And he's got a lot of really nice articles on there too. The benefits of massage therapy, the different types of massage.
There's a really good one on there about water intake and how important it is, how it goes through the entire system. It's a great read. Especially
for after your massage. Well, before and then of course after your massage, sort of once you've broken up all those toxins and bad things to sort of flush them out of the system. So definitely find him on Facebook, and again, he's located here at Bellefonte Pavilion, and that way on Facebook you can find out. I know you post free appointments that are the ones that are available, and like I'm here from such and such time, such and such time. If anybody wants the 3 o'clock appointment, just let me know. So it's a great way to stay, in touch with you.
There was one other thing I wanted to talk about. A lot of people ask me in their weary massage because they think they have to get completely disrobed. That's not true. It's their comfort level. If they want to stay fully clothed, I can work on them for an hour through their clothing. I cannot use the same techniques that I would in certain other modalities, but I can do that. And if their comfort level is completely naked, they'll be under the sheet the entire time. I will not see anything except for the parts I'm working on.
Sure, and that's an important factor. A lot of times people are shy about coming, in to get a massage. I, on the other hand, am not. I love getting massage. I would get one a week at the time, and I even think there's an article on your Facebook page about someone who does get them once a week and how they make that a priority.
Anybody can afford a massage if they really want one.
Exactly, because there's a lot of other junk we spend our money on, and she was talking about how it was nice that she's actually penciled in that time for relaxation and how important it was to her lifestyle and keeping healthy. Yes, so thank you so much, Lonnie. We really appreciate the interview. And again, El Massage here at Bellefonte Pavilion. Thank you.